The day brought together over 50 diabetic patients across the district to seek advice from the health workers and share ideas on how to deal with the sickness among themselves under their umbrella Association of Moyo Diabetic Patients Association. Honorable Aleruto Maza, the Member of Parliament West Moyo County, during the low-key occasion advised the patient to always be active, avoid reckless lifestyles, have balanced diet, follow the advice of the doctors and embrace routine checkups so as to be alert of what they are going through so as to remain strong and carry on with their life.
They should be active, they should avoid the alcohol, they should avoid loose and reckless lifestyles, they should have enough rest by sleeping early. Even the kind of food they are taking should be, they should have what we call balanced diet, where there must be greens, there must be, vegetables, there must be fruits, there must be, meat and so on. It should be balanced. And also, they should be able to listen to the advice of doctors and not just go to the counter and pick medicine and start swallowing. They must always have health checks, routine health checks, so that they can know whatever is taking place in their bloodstream. Otherwise, the kind of food they should eat should be the one which has been given for them by the doctors. Those with diabetes should avoid anger. They should be tolerant. They should not quarrel. They should always avoid issues. They should always learn to avoid problems. They should be friendly. They should always reconcile and always be happy and smile.
Kareodu Gilda, the in-charge diabetic clinic at Moyo General Hospital, said the clinic has over 250 patients who receive drugs on monthly basis, but those with special needs are also considered. She re-echoed that the patients need to always adhere to the advice of their doctors and embrace self-medication if they want to recover from the disease.
In the clinic, I have about 250 clients who are around. And I give them drugs. They come monthly for 1 month. But if you have a problem, I can give you for 2 months after you have prescribed to me. So what my advice to them is follow the instructions doctor has given you. Take the drugs accordingly so that you will be healed. If you are taking the drug healing, you have no problem. But when you are not, one day you are not taking, 2 days you are not taking, that's when you get a little problems. So I think that they are taking that advice. As you are seeing them, they are okay. Self-medication, when they come, we educate them about the self-medication because nobody will follow you. Most of my clients are the old people. They don't have people to stay with. Most of them stay alone or with a grandchild. So we help educate them. This drug, you take it daily at the same time. Until I will educate them. So as we educate them, they are taking it.
Obiku Joseph, the chairman Moyo Diabetic Patients Association, said they use the day to get educated about the disease through sensitization and carry out tests and screening for those who want to be tested, and therefore urge the public to always join the patients so as to learn and guide against the disease.
We are getting education because diabetic is a very serious disease. Our request to everyone is, when this day comes, we invite everybody, even if you are not sick yet, but you come. We have sensations by the doctors. They give us sensations, and then the symptoms. Then also, if you are not affected, they also advise you people to come and test yourself before, so that this disease may not affect you so much. So I'm appealing to everybody, when there is this day comes, the World Diabetes Day comes, we also request you people outside there to come and join us, and you also receive the educations given by the doctors, so you can prevent yourself.
Okumba George Draleke, a diabetic patient, said he was diagnosed with the sickness in 2020, and since then he has been adhering to the advice of the health workers and also urged those with the disease to always pay keen attention to the advice of the health workers, always eat the foods prescribed by the health workers and avoid seeking advice from those who are not infected with the disease, and should avoid starving themselves so as to remain healthy.
Mesu kinya mutiri se mata diaro eto kinya na fulure ta tijo aruri dola zare nye sune kole ani sobi daktari nye pritirira ta joli reka li erijo aruri ta unyalere kole ani niovi kana ote ta nazo aruma joa la kiangwere sa keri otere bazi ka device nye tandika lazari idu ya koko nya rezine lazari tore kanya device tuisika madizi lazari yako re zara.
Every year, the world commemorates the World Diabetes Day, aimed at creating awareness about the disease and sharing ideas on how best to handle diabetic patients across the globe. It's from this background that the Diabetic Patients Association in Moyo gathered to celebrate the day under the theme, Access to Diabetes Care, Leave No One Behind. Dominic Anthony Okumu, West Nile TV, Nilecast.